Hello and welcome. Today we're diving into a common yet often misunderstood eye condition, the retention cyst of the conjunctiva. We'll explore what it is, what causes it, how it's diagnosed and treated, and what you can expect if you have one. So, let's get started. So, what exactly causes a retention cyst? Well, as the name suggests, it's all about retention, specifically the retention of fluid. These cysts typically arise from the blockage of tiny glands within the conjunctiva, known as the glands of Henle or the glands of Mans. Imagine these glands as miniature faucets, constantly producing lubricating fluid for the eye. When one of these faucets gets clogged, the fluid backs up, forming a little sac, the cyst. Common culprits behind these blockages include minor trauma to the eye, inflammation from allergies or infections like conjunctivitis, or even just normal wear and tear over time. Sometimes no specific cause can be identified, which we call idiopathic. Let's talk about the how behind the cyst's formation. The conjunctiva, the clear membrane covering the white part of your eye, contains these small glands. When a gland's duct becomes obstructed, think of it like a kink in a hose. The fluid it produces can't escape. As the fluid accumulates, it stretches the surrounding tissue, creating a fluid-filled sac. This sac is lined with cells from the gland, continuing to secrete fluid and further enlarging the cyst. The cyst may remain small and relatively harmless, or it can grow larger, causing discomfort or even affecting vision in some cases. It's important to understand that this process is usually benign, meaning it's not cancerous. Retention cysts of the conjunctiva are quite common, affecting people of all ages, genders, and ethnicities. However, they are more frequently observed in adults than in children. While there's no definitive data on the precise incidence rate, they're encountered regularly in ophthalmology clinics. People with a history of chronic eye irritation, allergies, or previous eye injuries might be at a slightly higher risk, but anyone can develop a conjunctival retention cyst because they're often painless and don't cause significant vision problems. Many people may not even realize they have one unless it becomes large enough to be noticeable. So, how do you know if you have a retention cyst? Often, they're discovered incidentally during a routine eye exam, but you might notice a small, clear or slightly yellowish, raised bump on the white part of your eye. This bump is usually painless, but depending on its size and location, it can cause a foreign body sensation, like something stuck in your eye. Larger cysts can sometimes blur vision, especially if they press on the cornea, the clear front part of the eye. In rare cases, the cyst might become inflamed or infected, leading to redness, swelling, and discharge. If you experience any of these symptoms, it's important to see an eye doctor. Diagnosis is typically straightforward and based on a clinical examination. Your eye doctor will carefully examine your eye, using a slit lamp, a special microscope, to get a magnified view of the conjunctiva. This allows them to clearly see the cyst and rule out other possible conditions. In most cases, no further testing is needed. However, in rare instances where the diagnosis is uncertain, or the cyst has unusual characteristics, a biopsy might be performed to examine the tissue under a microscope. While retention cysts are generally classified as a single entity, they can vary in size, location, and appearance. They can be small and barely noticeable, or larger and more prominent. They can be located anywhere on the conjunctiva, but they are most common near the inner corner of the eye. They can also be single or multiple. There isn't a formal classification system beyond these descriptive characteristics. Fortunately, most retention cysts of the conjunctiva don't require any treatment. If the cyst is small, painless, and not causing any visual disturbances, observation is often the best approach. In many cases, the cyst will resolve on its own over time. However, if the cyst is large, bothersome, or causing symptoms, several treatment options are available. These include a simple needle aspiration, where the fluid is drained from the cyst using a fine needle, surgical excision, where the cyst is carefully removed with a scalpel. Topical medications, such as steroid eye drops, may be prescribed to reduce inflammation and prevent recurrence, although they are not the primary treatment. The choice of treatment depends on the size, location, and symptoms associated with the cyst, as well as the patient's overall health and preferences. Unfortunately, there's no guaranteed way to prevent retention cysts of the conjunctiva, especially since many cases are idiopathic. However, you can take steps to minimize your risk, practicing good eye hygiene, avoiding rubbing your eyes excessively, and promptly treating any eye infections or allergies can help. If you wear contact lenses, be sure to follow your eye doctor's instructions for proper wear and care. Protecting your eyes from injury with safety glasses during activities that pose a risk of trauma can also be beneficial. The prognosis for retention cysts of the conjunctiva is generally excellent. Most cysts are benign and resolve on their own or with simple treatment. Recurrence is possible, but often manageable. Recent research has focused on improving surgical techniques for cyst removal and developing more effective topical medications to prevent recurrence. Minimally invasive approaches are also being explored to reduce discomfort and recovery time. The future looks bright for even better management of these common eye conditions. Thank you for joining us on this informative journey. If you suspect you have a retention cyst, consult with your eye doctor for proper diagnosis and treatment.